April is National Rosacea Month, and it's something that affects 16 million Americans. So joining us to talk about some of the possible causes and cures is dermatologist Dr. Sabrina Fabi. Dr. Fabi, great to see you.
Nice seeing you, Jen.
All right, so we've talked a lot about, I've heard the term rosacea. What does it really mean? How does it differ from just, say, having rosy cheeks once in a while?
Well, sometimes rosy cheeks can actually be a sign of rosacea, but if it's in a baby, probably not. But rosacea is a condition that, yes, as you mentioned, affects 16 million, and it's characterized as people that usually get this diffuse redness, typically after the age of 30 years of age. It starts with flushing that comes on sometimes with drinking alcohol, eating spicy foods or hot foods, and then progresses. You start to see red bumps and you start to see veins as well as blood vessels. Some people even notice a thickening of the skin around the nose called rhinophyma, which we classically see in men.
Interesting. Okay, so you talked about some of the things that we're seeing. What about some of the things that would cause it? Are there certain triggers, for example, more people more susceptible?
I know if we could finally find out what caused it, we'd probably treat it a little bit better. That's the problem with rosacea. There's no cure. Once you get it, which usually manifests around the age of 30, then it's really treating with topical treatments when you start getting bumps. At the beginning stages of the condition, it's usually lasers and light devices like the ones that I do in my office that really help close those blood vessels and decrease the redness and the flushing. But once it progresses to bumps, which we call acne rosacea, sometimes it actually requires oral antibiotics. Not because it's necessarily a bacterial infection, but because of the anti-inflammatory effects that those medications have. As well as topical treatments. They can decrease inflammation and also improve the appearance of those bumps and pimples that patients get that actually are quite distressing for patients, even though it's such a superficial condition.
Are there things, is this like a genetic thing? I mean, are there things we could do to prevent getting it in the first place?
Yeah, unfortunately not. They have found 2 genes that are associated with the condition, and we typically see it in fair-skinned individuals. About 33% of patients that have it are actually of Irish descent or English descent, so there's definitely that component, but today there's such a heterogeneous population that everyone has a little bit of that gene pool. And so although there is a genetic cause, there are other things that may trigger the condition, and if you decrease those triggers, whether it's alcohol, spicy foods, hot foods, exercise, or being out in the sun, we have actually found that flushing can improve substantially.
Interesting. All right, Dr. Fabi, great to have you on Rosacea Awareness Month for this
Thank you for
April.
having me, Jen.